back, and this is our session on HIV and AIDS. So in today's session, we're going to be looking at HIV and AIDS and a few ethical issues related to this. First of all, we're going to start off with what HIV actually is. So that's a A-level diagram of what the HIV virus looks like. So just using that, and maybe if you don't know a lot about AIDS or HIV, could you use that diagram to sort of explain how HIV infects the body, or exactly what HIV is, or any sort of issues you might know with it in the current health climate of the world? Anyone? Maybe where it's most prevalent, maybe any, if it has a cure, if it doesn't have a cure, if there is a cure, what is it? Where it's, any research in that field. Replicates in T helper cells. Yes, that's good. Anyone else? I'm presuming everyone has sort of an understanding of A-level biology of what T helper cells are. If not, please let us know and we can just quickly clear that up. It's not a huge topic. We can really quickly make that known. Anyone else? Oh, so okay, so T helper cells are, so there are two types of cells in your body. There are B cells and T cells. T cells, they're just called because they mature in the thymus. T helper cells are involved in, so for example, when you get a vaccine, they're the cells that are involved in helping build immunity. And T helper cells are the kind of cells that bind to, like, I'm sure you know what antigens are. They bind to the antigens of this virus and cause cells to replicate to form antibodies. That's the long and short of it. And that's really it. Now, what the person who said replicating T helper cells meant by replicating in T helper cells is that actually HIV or many viruses enter a cell and use the cell's content to replicate. Does anyone know how it replicates? This is also A-level biology. Again, if you don't know, be honest, we'll just let you guys know. It's not, again, that's not too difficult either.
We're going to cover HIV replication in just a couple of slides, so don't worry if you don't understand. But yeah, it's not too important. Just, I'm sure you have a vague understanding of what a virus is and kind of, how it infects things. But when we look at the ethical issues, that won't be too important.
Someone said it makes double-stranded DNA from viral RNA template and inserts it in human DNA. Yeah, so that is actually the long and short of it. It's got a few, for example, the enzymes involved, etc. But I think we're going to move on to that anyway. So really well done for the concise summary of what HIV is. I think we're going to move on. Yeah, so HIV is human immunodeficiency virus. It's a virus that damages the cells in your immune system and weakens your ability to fight everyday infections and disease. So that's written by the NHS, and actually when it weakens your ability to fight everyday infection. Actually, can anyone explain why it may weaken your ability to fight everyday infections and disease? Just quickly from what we learned about the previous slide. Someone said it before, it does something to your body. While that person, everyone's having an idea about that, I'll carry on reading. Severe damage to the immune system can lead to AIDS. So this is when, this is when your T helper cell count is below a certain amount. So HIV leads to AIDS. AIDS is a disease. HIV is the virus. As someone rightly said in the previous slide, HIV is a retrovirus. It has RNA as its genetic material. HIV contains the enzymes reverse transcriptase. Please ask everyone to just, thank you. HIV contains the enzymes reverse transcriptase, integrase, and protease. HIV is difficult to treat as it can be dormant, it attacks immune system cells, and it has high antigenic variability, which I'm sure everyone knows what that is, but basically antigenic variability is when the glycoproteins on the surface of the virus can change. Shivas, if you just quickly go back to the diagram of the, so as Shivas has written, it's got the enzymes reverse transcriptase, integrase, and protease. If you look at the where it says genetic material RNA, you can see in the middle the two sort of pomegranate seed shapes, reverse transcriptase. That's not the only enzyme. So the whole thing is called the capsid, is where the enzyme in the RNA is held, and within there you've got integrase and protease as well. And then the antigens antigens are glycoproteins. They're not the attachment proteins. I don't think this diagram actually shows the antigens, but they're just the glycoproteins on the surface of the virus. Cool. Then also, it is transmitted through sexual intercourse or the exchange of bodily fluids. Modern drugs mean that early detection of HIV can lead to patients leading near normal lives. However, there is no cure for HIV, sadly. As of 2013, there were 107,000 people in the UK living in the UK with HIV, a quarter of whom were unaware of their status. So it's very important. This is actually one of the things that we've discussed in previous sessions. It's very important to go to a regular checkup. And, if you're sexually active, you should be getting tested if you think there's any symptoms of any disease, because you may be spreading HIV without knowing it. Which is not, that's not only is that dangerous, but it's also dangerous if you have HIV and it's going untreated. But those are the sort of the quick fire facts about HIV. But we're going to go through each one of those facts a bit more in detail now.
Yeah, so we're going to talk a little bit first about kind of the science of HIV. We already have touched upon some of this stuff, but to do with how it replicates, which will be a little bit important later when we discuss some of the ethical issues surrounding it. So this diagram just kind of summarizes the process by which HIV infects cells and is able to replicate itself. So it will firstly bind to the cell, and as we said before, it binds mainly to T helper cells. And it will bind to CD4 receptors, which are located on the cell, and it can bind to these using its attachment proteins, and then it's able to fuse with the membrane, the cell surface membrane, and its components. So its RNA, its enzymes like reverse transcriptase, and various other proteins move into the cell, and then, as we can see here in step 3, reverse transcriptase will convert the virus's RNA into DNA, which can be integrated into the DNA of the cell itself. And this will allow the cell to produce new virus particles and the components of these virus particles, which allow it to be assembled, and then it will allow it to leave the cell via budding. So, as we said before, more and more T helper cells being damaged leads to a lower count of them in the body. That can obviously mean that there is a reduced ability for the immune system to defend itself against other diseases, common diseases, which most people can fight off quite easily, and that will eventually lead to AIDS, which is where a person's immune system is so compromised that there's a very high risk of them dying due to not being able to fight off the most basic infections. Yeah.
Just sorry to interject there, Shabazz. Does anyone know what the names of these type of infections are? That sort of infect when you have a already low immunity. That's an awfully worded question, but basically,
is it opportunistic virus?
Yeah, exactly. Yeah, exactly. Opportunistic infections. Yeah.
Yeah, great. So I think we'll move on now, and we're going to talk a little bit more about the ethics of HIV, which we have touched upon in past sessions. But firstly, I've got a question here. Why might someone want to keep their HIV status confidential? Why might someone not want to disclose this information, even though disclosing it could have some benefits, as we'll talk about soon? Someone immediately has said in the chat, stigma. And I think that is one of the most important issues surrounding HIV. There is still quite a big stigma surrounding it. Many people don't feel comfortable sharing this information because they feel like they'll be judged by their family, by their friends, by potential partners. So yeah, that's definitely a big one there. Does anyone have any other suggestions? I think stigma is the main one, but perhaps with regards to, yeah, well, actually, someone has said affects future relationships. Yeah, that's very true as well, which does link to the stigma. It does, obviously having HIV means that physically it can be harder to, have relationships, especially ones where, sex is a large part because of the risk of infection. As we know, HIV is exchanged via sexual intercourse. So yeah, absolutely. So I've got a few suggestions here on the screen. You know, the first one I've got here is the stigma, which we've talked about, and this is actually especially prevalent regarding gay or bisexual men, for whom the risk of transmission of HIV is higher. And therefore, you know, in the 1980s, when this virus first sort of came about, there was obviously a large stigma, and this kind of polarized society in the United States, in Europe, where, you know, because this virus was more common among those people, many people looked at it as a kind of, you know, it made these communities more isolated from the rest of society, and that is still being felt today in many parts of the world. And it could limit access to promotions or jobs as well. Sometimes you are asked to disclose your HIV status when you're applying for a job. Many people think that that shouldn't be the case. Sometimes people think that you know, having HIV means that you won't be able to perform your job as effectively. So you know, that's very that's a big consequence as well. As someone said, it could affect your relationships with your friends or potential partners in the future, and it could upset family members and friends as well. So yeah, I think there are quite a few different consequences which are important to consider, and this is kind of why some of the ethical issues surrounding HIV arise. So we're going to talk a little bit now about a case study with HIV, which we have looked at in the past, but I think it's important to look at it again and try and analyze it again, because some of you will be new to the session. So yeah, first of all, imagine you're a GP and two of your patients are a husband and wife. The couple come into your clinic one day for checkup. While the wife has gone to the toilet, the husband confesses that he has HIV, but he begs you not to tell his wife. So the question here is, you know, what would you do in this situation if you're the doctor? Would you, and I think an important point to consider, or some important things to consider, would be the 4 pillars of medical ethics in this situation. So these are beneficence, which is, you know, if what you're doing is best for the patient, and whether it improves their quality of life. Non-maleficence, which is about harming the patient. Autonomy, which is about their right to make their own decisions. And justice, which is about fairness and treating patients equally. So I'm sure you'll have come across these pillars before, but try and see now if you can apply these to this case study here and see you know, what decision you would make with regards to these 4 pillars, and if it's actually possible to come to a decision whilst, you know, respecting these pillars. So, you know, just put your answer in the chat, have a think about what you would do, and just try and use these pillars and try and see if you can come up with a solution which you might consider to be ethical or moral.
Feel free to speak up and just talk to us if you want to as well.
Yeah, someone's raised their hand. If you want to, if you want to contribute, please do unmute yourself. Maybe not. That's okay. But yeah, please do put any ideas you have in the chat, and then we'll discuss these.
Oh, I think that's the same person on the left.
Okay, someone's put an answer in the chat, so I'll just read that out. You've put quite a detailed answer here, so I'll read out what you've put. You've put, ask why he hasn't disclosed this information. Does he have anxiety about the disease? Does he understand all the treatments which are available? Is he aware that with effective treatment he would not be putting her at risk during sexual intercourse? Encourage him to address this with her. Agree a timeline to do this. Explain you'd have to tell her if he doesn't. And I think that's a really, really good, concise summary of what a doctor should do in this situation, even if it doesn't respect the pillars of medical ethics. you've made it quite clear that you should, really communicate effectively with both sides, with both people, try and understand their motives of why they're hiding this information, why the husband's hiding this information, and what potential consequences this could have for the wife. As we said, there is a big stigma, so that could be part of the reason. But perhaps that stigma is something which needs to be faced in order to protect her health. So you put, does he understand all the treatments available? Yeah, perhaps he doesn't. Perhaps he's scared that he won't be able to live a normal life, whereas that's not the case. Perhaps if he was more informed about HIV and how it can be treated, he might be more willing to open up about it, communicate to his wife about it, because there are many couples who have HIV positive people, and they are able to live normal lives because they're able to manage it, and they're able to take the correct medication. So you've also put, is he aware that with effective treatment he would not be putting her at risk? So there is although he might be scared that he is putting her at risk, it's possible that he wouldn't be if he was able to have access to the correct treatment. And you've said agree a timeline to do this, which I think is very important. It's not necessary for him to tell her straight away. Perhaps you could arrange several meetings with him to discuss his available treatments and his different options, so that you can allow him to kind of explain the situation in his own time, whilst also ensuring that the wife is comfortable. So yeah, so I think that's a really good answer. I wonder if anyone else can kind of think about a potentially different way in which you could act using the different pillars, because although you've given a really good answer here, I think some might argue that it might go against some of these pillars of medical ethics, including autonomy. I think is the main one. So does anyone have any if you were to respect autonomy, what would you do in this situation? So yeah, I wonder if I noticed some people had their hand up and they've unmuted themselves. Did anyone want to speak out loud?
I think autonomy is very important in this kind of scenario, especially as HIV and the potential of having AIDS is very high for this person, and we have to respect their decision to keep it a secret. But even though we might not necessarily agree with it, but I think it might go against some of the other pillars, because in doing so and keeping quiet about it, maybe you're putting the wife also at risk, and maybe it's putting a strain on both their mental health for the husband to keep quiet about it, and also the stress or the shock for the wife when she finally gets to know about it. And so in this scenario, it's a balance between autonomy and I think non-maleficence, in my opinion. And while I personally, of course I wouldn't break the news to the wife, as the patient had asked us not to, but I would still urge them to gather more information and contemplate and to see if they would like to break the news to their wife themselves.
Yeah, I think that's a really, really good answer, and I completely agree with you. I think that the main argument here is between autonomy and non-maleficence. It's to do with whether you want to respect the patient's right to keep information private, or whether you want to ensure that patients are able to, have a high quality of life, be comfortable, be happy, and be healthy. But as you've said, it's very important that we respect a patient's autonomy. That's one of the key principles of the NHS, is to respect patients' decisions, to and also ensure that private information remains private. But I also agree with what you said regarding kind of urging them. It's not a doctor's place to make decisions for the patient, but it is their place to inform the patient and make sure the patient is making an informed decision themselves, which in this case the patient might not be, because they're not potentially aware of all the risks of HIV or how it can be treated. So yeah, thank you very much. And I can see someone else has their hand raised as well. Did you want to contribute anything?
Yeah, I just want to add one point. if the patient, like if the person keeps on denying the fact that he's not going to tell his wife, then one option he could do is, I mean, I'm considering this because there's justice as part of the ethics, and a doctor's duty has the duty to protect and ensure the safety of like the society. So as the last option, I think it would be right if he tells the wife that the person has HIV because of justice, if you get what I mean.
Yeah, I completely understand. And justice is to do with treating patients equally. In this case, you could argue that you're not treating both patients equally because you're kind of protecting the health of one whilst not protecting the health of the other. And for society as a whole, if I'm sure this case isn't isolated. There are probably many couples for which this is the case, and therefore, if doctors as a whole keep this a secret, there could be a large societal impact whereby HIV is spreading more, and obviously that has a large impact overall for the health of the country. So yeah, I absolutely agree with you, and I think that this issue does it does allow all four of these pillars to be debated really. So yeah, thank you very much. I think everyone gave really interesting answers, and I think we've covered most of the main points for this one. So I think we'll move on. We're going to remain with this case study, but we're going to look at it from a little bit of a different angle now, regarding deontology and consequentialism, which is something we did talk about a long time ago in one of our first sessions. So I think Sinan's going to do that.
Yeah, so we're going to talk about deontology and consequentialism, which is actually a topic we've covered before, and it's an ethical theory. So can anyone sort of come out? The second one is quite easy. Think about consequentialism, what branch of ethics, and what could it be defined as? Could anyone think about deontology? That might be a bit more difficult because the name is not a huge giveaway. Just any ideas. It's fine if you don't understand it or if you don't remember. Any ideas at all what either could mean?
We've got like a couple of pictures here to kind of help you. But yeah, for consequentialism, I think it is a little bit, it's quite easy to see kind of what it means.
No, that's fine. Okay, so consequentialism is the idea that, okay, fine, we'll do deontology first. Deontology is concerned with what people do. Deontology teaches that something is inherently wrong, whereas others are inherently right. Immanuel Kant, who was a philosopher, believed that there were a set of universal moral rules. So, for example, don't lie, steal, cheat, murder, etc. Applying deontology is simple. You just follow these rules. Obviously, I'm sure everyone can come up with some sort of an idea of why is this may be wrong, where a moral gray area is concerned, where it might be legal, but you might not find it moral, or it might be moral, but it might not be legal, that kind of thing. Consequentialism involves judging actions by their results. This means you have to weigh up the costs and benefits of a decision before making it. If the consequences of a decision are mostly negative, you should not go ahead with it. If the consequences are mostly positive, you probably should. You could see actually in the picture before that the person was hitting sort of the block onto another person. And obviously, if you were following consequentialism, you would not do that because you would realize that would possibly kill the other person. It's not right to break the patient's confidentiality, and it's not right to do harm to the partner of the patient. Yes, exactly. This is where it becomes really difficult because you have to, A, sort of weigh up the pillars, but B, you also have to weigh up whether the pillars are more important than an ethical theory. And that's where some bias and subjectivity comes into the question as a doctor, because then you have to make the moral judgment, which is really difficult. And that's what Shivas is trying to highlight here.
So I think we'll go back to this case study actually, and just have a look at it from a new angle really. Now that we know what deontology and sorry, that's spelt wrong, but and consequentialism mean, I wonder if anyone has any idea about how you would go about, if you were a doctor in this situation, how you would treat the patients in this situation, if you were following A, deontology, or B, consequentialism. Would they lead to kind of a different outcome, or would they lead to a similar outcome? And I think the main point you have to consider is to do with lying, which links to autonomy, but it's about lying to a patient, withholding information which might seem morally wrong. So yeah, please do put your any suggestions you have in the chat, and we'll go over them. Someone said, you mentioned in a previous session about how funding in the NHS works. Would you say that HIV is one of those key budgeting requirements which many resources need to be assigned to? That's a very interesting question. And I think, well, as of now, I think most of the NHS resources are going towards, the current pandemic, which is COVID-19. But I think HIV is a large part of research, medical research, is going into HIV, and that's because it's not a disease which can be treated easily. It's very unique for each person, and therefore we need a lot of new innovation, and therefore lots of research facilities, lots of universities are kind of experimenting with HIV, whereas it's not something which is so highly budgeted in hospitals themselves. But HIV has been a significant issue for the last 40 years, and it's still not gone away. It's still one of the largest killers. So yes, it is one of the areas which is still very significant, and a lot of funding is still needed for it. So yeah, and we will look a bit later in a couple of slides' time at the possibility of an HIV vaccine, which is something which is being investigated. There has been some progress with that, but we'll talk about why, for example, a COVID vaccine was able to be developed within a year, but an HIV vaccine, hasn't been developed, even though it's been 40 years. Yeah, so nobody's really put any suggestions towards this case study. I'm sure you're all having a think about it, but I'll put up kind of, a few bullet points regarding what you would do in each situation. So first of all, with deontology, we know that deontology is about following basic principles, basic guidelines, which are morally right or morally wrong. And as we know, deontology teaches that lying is morally wrong. Therefore, deceiving the wife by withholding information is morally wrong, and therefore, according to deontology, you should tell the wife. And according to consequentialism, the consequence of not telling the wife is that she could contract HIV through unprotected sex, which could lead to AIDS. Telling her could prevent this, therefore you should tell the wife. So actually we've got the same solution in both, if we follow both. But these are both kind of very open to interpretation. Like you could argue that the consequence of telling the wife could hurt the husband. It could have a large mental effect on him, because he's uncomfortable with sharing this information, and therefore you could argue that the consequence of that is negative, and you shouldn't follow that route. So in medicine it is very tricky, and that's why medical ethics is such a big issue, and why it's constantly being debated, and why there is such a legal importance of that. So yeah, I've noticed someone's raised their hand. Did you want to contribute something?
Hiya. Basically, can you please explain how, for example, because I thought if you follow deontology, then the GP doctor should follow autonomy as well, which is listening to the patient's wishes. But I wasn't sure how, I'm not sure. Can you explain more how actually that is wrong?
Yeah, well, as I said, it is kind of open to interpretation, really. This isn't the exact answer that someone will follow, and you're absolutely right. If following a patient's wishes, respecting their wishes, could be seen as something which is kind of universally morally right, and therefore it could still be deontologically argued that respecting a patient's autonomy is morally right, and therefore that's what you should do. So this is just kind of one route which you could follow. But it's just kind of another angle of approaching this situation and trying to work out how you would go about doing that. So you're right, and in a real life situation, that is what you would do. Doctors are obliged to listen to a patient, to respect a patient's autonomy, but we're just talking about it kind of more hypothetically here. So yeah,
I think also sorry, to answer your question, basically I think it's, as Shivas described, deontology is basically something that's inherently wrong. It's inherently wrong to lie. it is wrong to break patient confidentiality, but it's not inherently wrong, if you get what I mean. That's not something we're taught as kids, that, you know, you shouldn't break patient confidentiality. So even though it's wrong, it's not something that's a commonly well-known rote learned thing such as lying is. So that's why deontology, which concerns itself with inherent immorals, would consider the fact that lying is morally wrong, and maybe it's that's why, you know, the doctor might not break might be willing to break patient confidentiality, because lying is more of a given wrong than breaking patient confidentiality, because lying can be seen as always wrong. Patient confidentiality, sometimes you should be breaking, or very rare cases, and even then there are strict guidelines as to when to do that. But yeah, I hope that answers your question.
Yeah, that's fine. Thank you.
Mhm. Yeah, so yeah, thank you everyone for that. And I think, you know, as we can see here, we've come up with kind of a variety of different lines of reasoning using the 4 pillars of medical ethics and deontology and consequentialism, which shows that there isn't really, you know, you could argue that it's moral to go down either route of either telling the wife or not telling the wife. But we're trying to come up with kind of a basis or a reasoning for both. But you know, in a real life situation, you know, as someone explained at the beginning, it would be right to not immediately tell the wife, but try and advise the husband. That's what would be medically required in this situation. So yeah, we're going to move on now again, and we're going to talk a little bit about HIV and pregnancy. Um, so as I think I'm not sure if we mentioned at the beginning or not, but it's possible for an HIV positive pregnant woman to pass on her condition to her baby. And this can be done through, you know, via the placenta, via breast milk as well. And these mothers also have a slightly increased risk of miscarriage. However, if pregnant mothers take antiretroviral drugs, they abstain from breastfeeding, and they're regularly screened, the risk of passing on HIV can be reduced significantly. So the question we're going to ask now is whether it's ethical for HIV positive women to have children in the first place. You know, for example, should the government not allow them to have children, or should it be advised that they don't have children? Would that be ethical? Would that be morally right? Should they be banned from having children? You know, and what kind of issues could that raise when you're looking at the 4 pillars of medical ethics? And secondly, should HIV positive mothers be allowed to terminate their pregnancy if they find out that their child has a high risk of being HIV positive? We've asked a similar question in the past in previous sessions when we've looked at various inherited conditions, and whether, you know, or things like autism. If a patient is diagnosed with autism, if that's found out during pregnancy, is it ethical for a mother to terminate that pregnancy just because the child will have autism? You know, and it is a debate that's very commonly had. Some people disagree with abortion altogether. Some people think that it can be done on certain conditions. So, you know, we'll just ask you what you think in this situation. So yeah, if you want to answer any of the questions that we've got up here, please do put your answers in the chat, and we'll be happy to talk about them. So firstly, someone said it is unethical to ban them from having children, rather find ways to manage it to deliver the baby safely. That's okay, that's fair enough, but that doesn't necessarily, you know, stop the risk of them having HIV. If they, you know, if they did have children, that would mean that there are more HIV positive people. Just to kind of play devil's advocate, there are more HIV positive people, and that would mean that, you know, in society, that would kind of increase the risk of HIV more generally. And, you know, obviously, if that's untreated for the baby, that could lead to AIDS, that could lead to their own life being very difficult. But, you know, you said there are ways to manage it. Even if the baby does have HIV, many people will argue that it's you know, it's unethical to abort them for having that, because it's possible to manage it. And if the baby, you know, if it's known that the baby has a chance of having HIV, then it will be easier for the parents to provide them with the correct medication, the correct treatment, and they'll be able to kind of deal with it from an early stage. As we saw at the beginning, there are quite I think it was a quarter of people in the survey didn't, were assumed not to know about their condition. And that's why AIDS can develop so quickly. You said, I can see advice with adoption can be a solution for females with HIV wishing to have children. Perhaps, but some people might still argue that it's unethical to give up a baby for adoption just because they have HIV as well. Someone also said need to respect mother's autonomy. That's correct, and that's why many people are kind of pro-choice. People are, since it's kind of the mother's body, it's her baby, it should be her decision as to whether she terminates the pregnancy or not. It's up to her whether she wants to have the baby or not, and it shouldn't be anyone else's decision. No one else should tell her whether she's allowed to do that or not. So yeah, I noticed someone had their hand raised. Did you want to contribute?
I think also, in addition, I think that there is a lot of management that will have to go with the mother or the parents having to take care of a child with HIV. And in that case, it may not be the case that every single pregnant woman will have the capability or the financial capacity to do so, even though it may be provided. They may still not have access to that, and the risk of their child having AIDS may be too large for them to carry. So I think that they should be given their own, like, the choice to abort the baby. And moreover, it may have a large mental impact on the mother, knowing that because of her own condition, she's going to affect the lives of all her children that she may possibly have in the future. And so I think in this case, it's a very sensitive topic, and it should be left up for we should advise them on what routes they can take, but the final decision must always be left to the patient themselves.
Yeah, thank you very much. I think that's a very very interesting answer, and I do agree. I think that you're absolutely right. Some parents will be able to cope with having an HIV positive child. They will be able to provide the financial support that's needed to provide various medication. And their child may very well be able to have a normal upbringing. They may be able to have various partners and still lead normal lives, as we know it's possible for HIV positive people to do. However, there are also people for whom having an HIV positive child would be too difficult. If they have HIV themselves, it may be difficult to provide treatment for both. And therefore, that should not be forced upon a woman to have that child, or they should be, as you said, allowed to make a decision as to whether they want to or not, because it can lead to more long-term suffering. So yeah, thank you very much. Someone said, I want to add, was anyone aware of the You campaign run by the NHS a few years ago? I haven't actually heard of this myself. U equals U, I think. Undetectable equals untransmittable. In summary, if you have an undetected viral load, you can't transmit the virus. Yep, that's very true. And that's why many HIV positive people are able to lead normal lives, because the drugs we have nowadays, the antiretroviral drugs, are able to control the levels to an extent that they are able to do that. And therefore, many people would argue that if a baby's born with HIV, or if a baby is going to be born with HIV, it's not ethical to terminate that baby's life, because there's a chance, or there's a good chance, that there will be nothing wrong with them medically, and they'll be able to be managed. They'll be able to have a normal life. And also, it relates to the stigma which we discussed earlier. If people are being aborted for being HIV positive, if HIV positive mothers are having to make that decision, it can lead to more stigma in the community with regards to people seeing HIV positive people as not normal, kind of isolated from society. And that's definitely something we want to avoid, because we know that that's not the case. Someone has added work on awareness in communities towards consequences of HIV. Absolutely, and that again helps to resolve the stigma. Someone's put, some people are born immune to HIV. Would that happen in this case? That's an interesting question, and I think immunity to HIV, well, I can't say I know specifically the answer myself, but with in terms of HIV positive HIV being passed on from mother to child, that will happen through the blood. The HIV particles will actually be able to move to the baby. But in terms of immunity, I assume that would have something to do with the antibodies being passed on from mother to child, which may very well be possible. But you know, I don't know the exact
I'd
science on
say
that.
in
Yeah.
that case, if the antibodies are passed from the mother to the child, that would be passive immunity. And not only that, but in passive immunity, antibodies are broken down. So I'd say they wouldn't be immune to HIV for long because, you know, the body would digest, it would break down the antibodies in the baby if they were from the mother, unless the baby is able to, you know, somehow create antibodies for HIV by themselves without being infected.
Yeah, but as I said, I don't know the exact case, but you're right. It would be, if it was passive immunity, then it wouldn't be long term, and therefore, you know, perhaps that child would still need to have you know, treatment against HIV. Someone has still, you've got your hand up. Did you want to add something else? Maybe not. Okay. Yeah, Siddhant, did you want to, you know, comment anything else on this topic?
No, not really. I think just want to stress, like, it's very rare for a baby to be born with HIV, even if the mother is HIV positive. And like Shiva said, it's quite possible for women who or men who have HIV to lead normal lives if they're given the proper treatment and if their diagnosis is done early enough. It's not unheard of. Some people are born. Oh, right. Okay. Cool. No, nothing else.
Okay, yeah, so thank you everyone again for contributing to this section. And then we're going to move on now. So now it's going to talk about the last thing today, which is about the HIV vaccine.
Okay, so as everyone knows, and as we've mentioned, there is no HIV vaccine. When HIV was first identified in 1984, the US Department of Health and Human Services predicted that a vaccine would be available within 2 years. 37 years later, there is still no vaccine. HIV possesses antigenic variability. As we mentioned, that means that the glycoproteins, the antigens on the surface, can change. Antibodies are specific and complementary to a certain antigen. So if the antigen changes, the antibodies that were made for the old virus no longer work. HIV can remain dormant, so it has a latency period where it can infect the body, but there would be no symptoms for, I think it's like, you know, it can be up to 10 years. So you could be infected for ages and you still wouldn't know. And this becomes very dangerous because, you know, you want to get treatment and diagnosis as early as possible, but without knowing that you have it, it's actually very dangerous. And there is no suitable weakened or dead form of HIV which can be used in a vaccine, because a vaccine is a attenuated version of the pathogen. And because we can't produce this, a live virus is too dangerous to use, as we know, therefore there is no vaccine. I think we're just gonna do this quickly because I'm aware of the time, but can anyone think of any ethical issues of an HIV vaccine or just vaccines in general? How are vaccines sometimes developed? Yes, someone raised their hand, please go ahead.
I think economical differences between the developed and undeveloped world, like in the developed world, are very common. And like the UK already has a very widespread vaccination program, but there are still many countries that still have not had access to any vaccines at all for COVID-19. And I think that comes part with all kinds of medication and vaccinations and prevention methods, and that a lot of even the most highly communicable diseases are limited by the capacity of governments around the world to control that part, to control that disease in their own population.
Yeah, that's a great point, actually. Yeah, I didn't think of that one, but that's, yeah, really intelligent. And sorry, someone else has their hand up. Go ahead.
I think it's unethical in the fact that, you know, you're not able to test it on someone, and to test it on someone you need a volunteer, and you know, you don't know the consequences of the vaccine, for example, that you're making unless you test it on a patient. I think that's the ethical issue that with the vaccine.
Yeah, that's a really good point, and I think that also relates to drug testing. Another one I was thinking of was animal testing, because of the fact that obviously when you're creating antibodies, one way to do it is by injecting mice, for example, with the virus, and then they would create antibodies, but they would also, or you could inject them with antibodies. They have cancer cells, obviously. Oh, sorry, wait a minute.
HIV.
Sorry?
You meant HIV, I think.
Yeah, sorry, yeah. So, I mean, Shivas can obviously explain, but when you create a hybridoma, you can filter it out to just get the antibodies, and then that could be used as a vaccine. Obviously, obviously that wouldn't be permanent, but you know that is one of the dangers, because you would have effectively be giving a mouse HIV, which is, you know, very, you should be doing you're by giving a animal a disease that's very unethical, as you know, because they have no autonomy and you're forcing it upon them. But there are many other concerns. So Shivas, if you just see some of the ones that Shivas found. Oh, okay, yeah. So, you know, who should the vaccine be tested on first? As we talked about, animal testing is a problem. How would it be tested? Like we said, is it worth investing in a vaccine when HIV is so hard to treat? Should we invest in antiretroviral drugs instead? I mean, sorry, you still have your hand up. Is there something you want to add? No, okay. So just to quickly explain what antiretroviral drugs are. As we discussed earlier in the capsid, there was the reverse transcriptase and the RNA. Antiretroviral drugs basically destroy the reverse transcriptase. So that means that the enzyme can't turn RNA into DNA in the T helper cells, and therefore the virus can't replicate. It can enter the cell, but it won't replicate. The problem is these don't always work. The reason being that obviously if a virus is already inside a cell, how would a drug reach it? And you know that's sort of a problem. But you know, that's a question to think about: is should we invest in drugs which could potentially stop it if a virus is so hard to find anyway? And could a vaccine lead to more discrimination or stigma surrounding the condition of HIV? Should a HIV vaccine be mandatory? We'll just take a vote on the last one. Does it, you know, who can say for sure if they think, should an HIV vaccine be mandatory? Just put it in the chat.
You can just put a yes or a no if you want.
Exactly. No. Okay, someone said no. Anyone else?
No, I think we've got, yeah, most people are just saying no. And I think that's, you know, we talked about this issue in a previous session as well, when we talked about vaccination. And, you know, most people will say no, they don't think it should be mandatory, because there are people who have side effects to vaccines, who oppose them for religious reasons. And although that can perhaps lead to lower herd immunity, can mean that more people are at risk. As we said, in all areas of medicine, it's seen as unethical to you know, go against autonomy, which is the main issue here. I should just add as well, the point that someone made about global inequality was, I think, really interesting. It's not one that I thought of. I put on here about discrimination, you know, in society, but also you're absolutely right in terms of global supply of vaccines. We can see that even now with the current pandemic, there is, you know, vast inequality across the whole world with regarding vaccines. Some countries have, you know, surpluses, some don't have any vaccines at all. So, you know, having an HIV vaccine would really create that even more inequality, and perhaps that could mean that, you know, people from certain countries are banned from entering others and stuff like that. It's, you know, it could lead to inequality in that way. Someone said, I have a test on HIV next week. Thank you for this. You're very welcome. Hopefully this will have helped you. Hopefully it will have helped all of you regarding HIV. And hopefully you know a bit more about the virus itself and the kind of science behind it, but also the ethical issues regarding it. And if any of you are going into the medical field, if you have interviews, or if you already work in the medical field, then hopefully this will have helped increase your kind of awareness of these issues and something for you to think about a bit more. So I think we should finish up now. It's been nearly an hour. So now, do you have anything else you want to add?
No.
I think everyone else has kind of covered the main points here. So yeah, thank you very much, everyone, for coming to today's session. We hope you've enjoyed it. Yeah, you will be able to access this session later.
Yeah, so I'll just explain that. Sorry, we if you go onto our Instagram, I'll just type that in really quickly. It's on the slide as well. But if you go there, there is a link to the YouTube account where we post all the sessions. We're going to be posting this one today or tomorrow. So please feel free to access it. Shivas, do you have a link to the actual YouTube channel that we could just put in here?
I've put a link. There is a link on the slide, but you won't be able to click that. No, I don't have one that I can put in the chat. But as we said, if you just type in the medical debate into YouTube, it should come up. And also there's a link on our Instagram page. Yeah, we do encourage you to follow us on Instagram, to subscribe to us on YouTube. You know, you can ask us any questions. You can by DMing us on Instagram or even emailing us on themedicaldebate@gmail.com. If you're not already on the mailing list, please do email us and we can add you to that so we can send you the link for next week's session. Yeah, someone said, will you continue these sessions over the summer? We usually have a session every week on Saturday at the same time. Oh yeah, we've got the link in the chat now. Usually every Saturday at 4 p.m. UK time. So, you know, please do, come every week if you can. Please tell your friends about this and anyone you think who'll be interested. Thank you to everyone who contributed today. And I think we'll leave it there. Thank you very much.
Yeah. See you guys next week.